Like us humans, pets can also experience hearing loss. On this episode of the Paw Report, we visit with veterinary neurologist Dr. Kari Foss. She'll discuss diagnosis, care, and ways we can make sure our dogs continue to live a quality life. Stay with us.
Finding a solution for your pet's behavior problem can be confusing. Dr. Sally J. Foote helps you help your pet. Private consultation and resources are available at drsallyjfoote.com. Foote and Friends, better bond, better behavior.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Hello everyone, and thank you for joining us for this edition of the Paw Report. As you can see, we are out of the studio again, and we've traveled to the University of Illinois to the Veterinary Teaching Hospital for this episode. A little pre-warning, where we're located, you can't quite see everything, but there's a lot of activity, a lot of action. There's horses going by, so if you hear some stuff in the background, that's why. Our special guest for this episode is Dr. Kari Foss. She's a veterinary neurologist. She's going to tell us all about how she became a neurologist. So thank you so much for joining us.
Thank you for having
First
me.
time on the Paw Report.
It is. I'm excited.
Excellent. Well, tell us about you. Our
Yes.
viewers are interested.
So, like I said, I'm Kari Foss. I'm one of the veterinary neurologists here at the Veterinary Teaching Hospital. And a little bit about me, my background. I grew up actually on a pig farm in Morris, Illinois. So kind of interesting for a pig farmer's daughter to go into a very specialized field of veterinary medicine. But this is where I ended up, but my background is I did my veterinary education and training actually here at the University of Illinois, so I am an alumnus and happy to be back here. It's exciting to have graduated from here and now instill knowledge on the future generations of veterinarians. Following my graduation, I did a rotating internship in small animal medicine and surgery out in Orange County, California. So I saw the ocean maybe 5 times in that year. And then after completing that, I bounced back to the Midwest to complete my residency in neurology and neurosurgery at The Ohio State University in Columbus, Ohio. Upon completion of my residency, I then stayed in private practice out in Ohio for about 4 years before making the jump to come back into academia. I just missed the teaching. I was in private practice in Ohio. I missed teaching students, interacting with them, having time to explain things. So I think academia is a very good fit for myself.
But you said neurology just wasn't your thing starting off.
So when I went through veterinary school, we unfortunately did not have a clinical neurology service here at the University of Illinois. So we had folks come down and teach us remotely. They'd come down for a day or two, and it's nothing against the professors that taught me. Neurology is a hard subject. Even the students here, I wish we had more time with them. And so it just didn't make sense when I was a student in the lecture halls. It just didn't fit, nothing clicked. And in my head, I was like, who in God's creation would do this as a specialty? I came into vet school wanting to be a surgeon. I still get to do that a little bit with neurology, but I was just like, this makes no sense. And then when I hit my 4th year, I went to an off-campus neurology rotation, and everything just clicked, seeing it put in action. What I love about neurology and medicine in general is it's like putting a puzzle together. My mentor in my residency used to say, and I do agree with him, that neurology is a little bit different from the standpoint of other services. You have the patient come in and you already know where the problem is, and then you work down addressing what the underlying cause is. Neurology is a little bit backwards because we may not necessarily know where the problem is in regard to the nervous system, whether it's brain, spinal cord, nerve, muscle, what have you. So we have to figure out where the problem is, localize it, then think about what could be causing it, and then work from there. So it's just this nice little puzzle that you get to put together.
Well, today our topics we're actually going to talk about two different things on this episode of the Paw Report. We're going to talk about hearing loss in animals, in dogs specifically, and also epilepsy, which is a study that you're actually involved with. We're going to learn about that. But how common is hearing loss in dogs?
Yeah, I think we don't have complete exact numbers. The most common form of hearing loss that we see, as it's been the most studied, is going to be congenital hearing loss or congenital deafness. And that has been documented in about 90 different breeds of dogs. And of those breeds, there is some reports in the literature that do show that about 30% within those specific breeds will have congenital hearing loss. I think it's hard to document as well because the signs can be so subtle that clients may not pick up on the fact that the dog is deaf. They might just think, oh, my dog's just older, they're becoming senile, things like that. So they may also not be coming in and being diagnosed with hearing loss as well.
Can you identify some of the many causes? You said congenital, but there's also some other reasons why dogs...
So when we think about hearing loss in dogs, we kind of categorize it based on what's happening with the hearing apparatus, essentially, or with their hearing. So one type of hearing loss we can see is called conductive hearing loss. That essentially means that the sound is not able to get from the outer ear into the inner ear, and then move into the brain and everything that has to happen. And so with conductive hearing loss, that's oftentimes caused by inner ear infections or sometimes really bad outer ear infections, foreign bodies. So we can see dogs get grass-ons down in their ear that can interfere with their hearing, or cats and sometimes dogs can get nasopharyngeal polyps. The other type that we can see is called sensorineural hearing loss, and that has to do with more either damage or abnormalities to the hair cells in the inner ear. So that's where we have the congenital hearing loss falls into that category, that pets, dogs are born with some abnormality that's affecting those hair cells and those mechanisms that lead to hearing. Or other scenarios are that it can be from ototoxic drugs or loud noises that can damage those hair cells as well.
Is hearing loss fairly common? I know you mentioned several breeds. Is it across the board a common issue?
I think we see it more commonly, again, as being a veterinary neurologist, that a client might pick up on it and then they want to come in and present. Like I said, I don't know how easily it's just being picked up on by the clients unless they're very in tune. I know later on we're going to talk about what to look for in a pet that might be diagnosed with hearing loss. But again, there's a lot of breeds that have potentially the genetics that could predispose them to developing, at least as far as congenital hearing loss goes.
So let's talk about those cues. You know, I'm a pet owner and I can tell you, they have selective hearing, and I use that as a joke, but there are some actual physical cues that your pet can give you to let you know something's just not right. Yeah,
and again, sometimes it can be a little tricky. If we're going back to the dogs that are born deaf or have congenital deafness, they may be a little harder to pick up on, and clients might not realize it, or breeders might not realize it until the puppy's removed from the litter. Because what can happen is, just like in humans, the puppy can pick up on their litter mate's behavioral cues and follow what they're doing. So they may not even be aware that that puppy can't hear at that point in time. So it's not until they're taken away from the litter that then signs start to show in. Some of those signs might be not responding to commands. If it's especially even maybe a dog that could hear, that then with age is losing their hearing, just like in people, owners may report, oh, they used to respond really well, now they're not. They might startle a little bit more easy, so the client says they come up behind the dog and the dog just jumps, and they're like, usually they wouldn't hear me coming up behind them. They may have actually a change in their bark or barking more than normal.
So if I'm a pet owner and I think that there might be a problem, how do you assess an animal that could potentially have issues?
Sure, I think the first step is to get a hold of your veterinarian and have the pet evaluated to make sure that there isn't some underlying treatable cause. Like I said, sometimes ear infections can cause them to have difficulty hearing, or foreign body in the ear, things like that. And if they can't overtly find an underlying cause, kind of the mainstay we determine essentially a yes or no, can the pet hear, is through a test called a brainstem auditory evoked response, or a BEAR test. Sounds really cute, like a little cuddly bear, but it's B-A-E-R, not B-E-A-R. And so what that does is it actually is able to test the hearing individually in both ears of the pet, and it's a test that they actually perform in babies when they're born to assess that they can actually hear too. Now, the one thing for that test is it's only going to tell me yes or no the dog can hear. It's not going to tell me is it sensorineural versus conductive hearing loss. So to get down to that, we need to take into account the signalment, so the patient's age, breed, history. Again, if I have a dog that was hearing before and is not, and I say, yes, it's deaf, we may be going down the route, do we need to, for example, CT to make sure there's not something going on in the inner ear. So essentially it is a yes or no, but it is a good screening test, just like in human infants, in puppies. That we can test, and that's a very simple way to say yes or no. In maybe a dog that's predisposed to congenital deafness, we can do the test, screen them, and say yes, this puppy can hear.
So I should have mentioned that we're in a room, we're where CT scans happen. So actually, pets can be put on this machine and be checked for any problems that you mentioned. Are certain types of hearing loss curable?
It again depends on the cause. Obviously, congenital deafness is not going to be cured, but potentially, resolution of an inner ear infection, things like that might. I never prep owners that that's going to be the case, but if they do get their hearing back, it's phenomenal. We had one police dog that actually had temporary deafness from a gun being fired in close proximity to the dog, and with some treatments, that dog actually did recover his hearing. Again, we kind of did repeat bear testing on him, and we were able to document that his hearing did return. Again, in those scenarios, I'm going to say it might be a waiting game to see if we can get that back or not. But unfortunately, there are some scenarios where the deafness, congenital, or if it's age related, just like in people, again, that deafness probably isn't going to come, or the hearing's not going to come back.
What kind of coaching do you give to pet owners when they're looking for advice on, they've accepted the fact that their pet has sustained some hearing loss, could continue to have hearing loss? There are ways that pet owner and pet can still communicate.
Yeah, and dogs are phenomenal creatures, and like you said, they've already accepted it. So the first thing too is if they adopt a puppy and it's deaf, it's not necessarily a reason to give the puppy up. They're not broken. Or as a dog gets older and goes deaf, they can still have a very good quality of life. A lot of people will say dogs more heavily rely on their sense of smell than they do hearing. So they can function very adequately without being able to hear. So some things that we can guide owners on are just visual cues. So simple as facial expressions. If the dog's done something good, a smile or excitement, like, yay, good job. Hand cues, so almost like doggy sign language for them. So you can teach them through cues, and to kind of solidify those, they can be prompted with treats, toys, kind of fun activities as a reward for following those cues. Other visual cues can be letting the dogs out at night, flashing a flashlight at them, or flickering the porch light that signals, hey, time to come in, because obviously the client can't call the dog when it's time to come back in the house. So kind of those visual cues as well. Going on that, as far as being outside and things like that. The other thing to adapt to is realizing that these dogs aren't going to be as aware of their surroundings as a normal dog would, or if the dog became deaf later in life than it was before. And so ensuring that they are monitored when they're outdoors, even if it's in a fenced-in backyard. These dogs, since they can't hear as well, they may be more susceptible to predators sneaking up on them, or being outside on a busy street, they're not going to hear automobiles. So also just more closely monitoring is going to probably be the bigger change in potentially the client's life if they did have a dog that could hear and is no longer hearing. But they can adapt, again, really, really well. The other thing that, like I said, with the puppies and the litters, is another dog in the household might be a benefit, because again, those dogs can pick up on the other dog's behavioral cues and learn from that.
Any breed specific that you know of that are prone to having issues with hearing?
So like I said, there's about 90 that have been reported. For the neurology service here at the University of Illinois, we tend to do those puppy screening tests. So the main breeds that we have coming in, it's probably going to, depending on what region you're in, but the ones we tend to see are going to be Dalmatian litters, Australian cattle dogs, had some Great Danes, and Bull Terriers. But the breeds that we tend to think of, or it's oftentimes deafness, and again, I'm going back to the congenital hearing loss, it's based off of coat color. So we have breeds that have that merle coloring. So if we think about like the Great Danes that are kind of the bluish with the spots, they have that kind of faded coat. Or piebalds are another one where they have the white spots with the white pattern. It's kind of that whiteness that makes them more predisposed. Can't go into all the detail, but kind of going off the coat. And then we have the Harlequin dogs that are a combination of the merle and the piebald. So any again, essentially any dogs that have a piebald coat color, a merle coat color, or the harlequin coat colors are kind of falling in that list of those 90 breeds. So a lot of times breeders of those particular breeds or puppies with that coat coloring, again, will do the hearing check in them. Or if a client is worried, testing their hearing as well.
Dr. Foss, we're going to kind of switch gears now. Another issue that can be scary for pet owners is epilepsy. What is epilepsy?
Sure. In the simplest term, epilepsy is asynchronous firing of the neurons or the cells in the brain. Our brain's always working and they're always firing at the same time, but how we can kind of keep under control is this nice balance of excitation and inhibition. And when we have a seizure, that balance is thrown off essentially, and then that results in the physical cues of an epileptic seizure, whether it's paddling, loss of consciousness, drooling, things like that.
What causes it? Is it something that is, again, something dogs are born with, or is it something that can develop over time?
Simple answer is both. So when we talk about epilepsy in veterinary medicine, we'll categorize it based on the underlying cause. So we will classify dogs as either being idiopathic epileptics. That's like you said, maybe they're born with it. Essentially the definition of idiopathic epilepsy is epileptic seizures for which there is unknown cause found. And by saying unknown cause found, those are dogs that have oftentimes come in, they've had a complete workup, an MRI of their brain, a spinal fluid analysis, ruled out any possible underlying reason for them to have seizures, and we have not found that. And so then we will classify them as idiopathic epileptics. Those dogs are typically younger in age, so probably kind of the rule of thumb now is 6 months to about 6 years of age. So if they're outside of that window, we need to look for something else. And then the other type of epilepsy we can see is called structural epilepsy. And so that is actually epileptic seizures that are caused by some kind of pathology in the brain. So we can see dogs can have strokes in their brain as well. So strokes can lead to seizure activity. Unfortunately, brain tumors can present with seizures. We can see dogs with inflammation in their brain, whether it's from an infection or autoimmune disease, which we just kind of generalize as encephalitis. Or again, we can go back to even just various birth defects in the brain can lead to their presentation of seizures.
Are there different types of seizures? And I guess what I mean by that, the severity, the time length, the reaction that the animal might have, like uncontrollable urination, vomiting, foaming at the mouth. I mean, these are all things that probably can happen.
Yeah, and those are kind of the classic signs that we all tend to think of. And again, just like in people, dogs can have various seizure presentations. And so in addition to saying, is it idiopathic or structural, then we also do classify it based off of the type of seizure that is happening. And so kind of there's a plethora of them that we don't have a lot of time to get into, but the kind of big two groups we see are going to be focal or generalized seizures. And so focal seizures are most often because there's just a very small area of the brain that's affected. And so what that leads to, depending on the area of the brain that's affected, is just very focal, potentially focal movement. So you might just see twitching of the face, twitching of an ear. It can be rhythmic movement of just one limb or one limb on one side of the body. The kind of characteristic thing is it's just very regionalized, if you will. So it can only be on one side of the body or just located to the face in and of itself. More subtle focal seizures can even just be as simple as drooling. Like you said, they might hypersalivate, so the dog might be drooling a little bit. Very subtle focal twitching, even sometimes just dilated pupils or vomiting can be the only sign of a seizure. So the focal seizures are more common, but they're a lot harder to pick up on if it's a more subtle abnormality that's happening. With the generalized seizures, those are kind of the classic seizure that a lot of people think of. Loss of consciousness, laying down on their side in lateral recumbency, the paddling, the flailing, again, drooling excessively. A lot of times they still have the focal seizure activity too, so the jaw's going to be chattering, they're going to be drooling, and they may or may not urinate or defecate in your face. Like I said, describing it also sounds very terrifying.
Right,
and it
can
is.
Be. I've seen them.
And you know, the good news, if you want to say it, is most seizures are very short in duration, albeit it can seem like an eternity to a client when they're witnessing their pet having a seizure. But most seizures typically last less than 2 minutes. And so they will subside. Again, it does seem like forever.
It does. Why is time, since you're speaking of time, why is that so significant when we're talking about seizures?
Yeah, the duration of the seizure is very important because, like I said, most of them are going to last less than 2 minutes. Some are even shorter than that. But we do have certain conditions or time lengths of seizures where they are considered an emergency scenario. So one scenario is status epilepticus, and that is where a pet is having a seizure for longer than 5 minutes. So that seizure activity is happening for more than 5 minutes, or the other kind of definition of status epilepticus is the pet has continued seizure activity, so they're not continuously seizuring. They might stop having a seizure, but they never regain consciousness, because that's what we want to see is like isolated seizures. So for me, either seizuring longer than 5 minutes or recurrent seizure activity without regaining consciousness is by definition status epilepticus. Why that is concerning is because prolonged seizure activity can actually lead to potential life-threatening complications, not just with the brain itself, but with the other systemic organs. So we need to have those pets evaluated right away. The other scenario that we tell clients, your dog or cat or what have you should be evaluated in an emergent urgent situation is called cluster seizure activity. So that's where the pet has 2 or more kind of separate isolated seizures. So they do recover in between the seizure, but they've had 2 or more within a 24-hour period. And the reason we want that is we don't want them to continue to have the seizures and potentially have them happening closer together with cluster seizures and potentially going into status epilepticus. So those 2 scenarios are where we do recommend that the patient is evaluated emergently.
Epilepsy is a topic that's very close to you. You're involved in some clinical studies involving epilepsy. Can you talk about what you're doing and what you're involved in?
And it's a hot topic.
It is hot.
Canine epilepsy is a hot topic throughout the veterinary community and throughout the veterinary neurology field. We actually have something called the International Veterinary Epilepsy Task Force. I think of them, I imagine them in their capes as superheroes convening once a year to talk about. I mean, it's a brilliant group of veterinary neurologists, highly respected individuals, and they're kind of considered the cream of the crop with managing epilepsy. But again, it is a very hot topic because right now we don't have a cure for it, and we're trying to find better ways to manage these patients, give them a good quality of life, and see if there is a potential down the road to provide more targeted therapy. And that's what my study is doing. Essentially, kind of to tone it down a little bit, is when we work up a patient with epilepsy, like I mentioned, idiopathic epilepsy is a diagnosis of exclusion, meaning that we've ruled out all other potential causes. So these patients have their MRI and their CSF analysis, and we've not found anything. And that's the MRI is great. It can help us identify things if there's an overt structural problem. However, that's all MRI is. It's a structural test. It's not a functional test. So we know with the epileptics, the idiopathics, that it's probably something more down at the cellular level that's happening with them. So we're not going to know where that seizure is arising from in the brain. We can just say we've ruled out X, Y, and Z. This pet is probably idiopathic. In human medicine, they're getting to the point now where they can even finitely pinpoint what's called the seizure focus. So that area in the brain where the seizure activity is actually arising from. And then they can provide more targeted therapy from that standpoint, whether it's implants and things like that. We're just not there in veterinary medicine yet. The way they're able to do it is a combination of imaging techniques, and also they can do electroencephalography. And what that is, an EEG, actually measures the electrical activity in the brain. We can do it in veterinary medicine, it's just, albeit a little bit more difficult. It's nice to catch the patient when they're actually having their episode. People, they'll do sleep studies, they'll keep them overnight in the hospital, they'll have cameras on them, they have, if you've seen a picture, all the wires hooked up to the head. Also, like you and I, don't have a lot of muscle up here. If dogs have big, really thick, meaty heads, so they have a lot more muscle that can cause artifacts. So it's a little bit more difficult. Not saying that it can't be done, it's just a lot more difficult and tasking to do in our canine patients. So in my mind, I'm like, well, is there a way still non-invasively to figure out what's going on? And so what we're doing is looking at an MRI technique called magnetic resonance spectroscopy that non-invasively measures specific metabolites in the brain. And they've been doing it in people for quite some time. And so my hope is that by looking at this, we've got a population of healthy dogs, because we need healthy before I look at the abnormal, and we're recruiting dogs with epilepsy now to see if there are changes, regional or very specific changes in the brain of these epileptic dogs compared to the healthy dogs, and then can that hopefully down the road provide more targeted therapy based on what we're seeing. Maybe down the road we can also see what effect the anticonvulsants have. It might be a way of monitoring. There was a study in people where they did this spectroscopy, and they found that people that were more refractory epileptics, so they were more difficult to control, actually had different metabolite changes on their brain than epileptics who were controlled. So
Well, it's a great
the future
thing.
is bright.
That's right. I was just going to say, good thing there's doctors out there like you that are dedicated to finding a cure,
Yeah.
I guess, because right now that's what you're searching for, and that's what you're
I
doing.
do want to also toot our horn is the sequence that we're using here for this study is only at the University of Illinois.
Wow.
So
Excellent.
there's
stuff.
other scanners that can do the spectroscopy, but we're actually able to image the dog's entire brain all in one fell swoop. So, and that is currently only
done here.
done on campus here and at VetMed.
Wow. Well, Dr. Foss, thank you so much
Yes,
for taking
thank you.
a few
It's been a
moments.
pleasure.
I feel like we could keep going
I
because
know.
there's a lot to talk about. And we really appreciate the insight, the information, and hopefully you'll join us again for another episode of the
Yes.
Paw Report down the road. Maybe we can revisit your study and see where you're at.
That'd be great. I'd love to.
So thank you.
Thank
again.
you.
And thank you for joining us for this episode of the Paw Report. We're glad you've joined us here on location at the University of Illinois Veterinary Teaching Hospital. We'll see you next time.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Fetcher's Pet Supply on the north side of the Charleston Square, serving the EIU community since 1991. Fetcher's welcomes all pets on a leash, is open 7 days a week, and offers made in the USA food. Pet supplies for dogs, cats, reptiles, and fish. Fetcher's Pet Supply in Charleston.
Finding a solution for your pet's behavior problem can be confusing. Dr. Sally J. Foote helps you help your pet. Private consultation and resources are available at drsallyjfoot.com. Foot and Friends, better bond, better behavior.